At this time, I'll take any questions from the panel.
I do, yeah.
Okay, go ahead, please.
Thank you. Thanks all of you for being with us. I appreciate your leadership and your testimony. Vice Chair Bean, I recognize the value of the investments that the Puyallup tribe have made in a correctional facility and tribal court system, what that's meant to public safety. I remember when you testified, I now can't remember if it was a year ago or 2 years ago, when you said if you'd known that the BIA wasn't going to uphold its financial commitments, the tribe would have probably made a different decision there. I know that there's chronic underfunding of the BIA's tribal courts and law enforcement programs, and I think that's something that this committee absolutely has to address. I want to get your sense. So on one hand, part of that is increasing those pots of money, but are there other steps that this committee ought to be taking to ensure that the BIA is fully supporting its 638 contract commitments to the Puyallup tribe and others?
You know, I think you're on the right path. I mean, it's bridging that gap. I mean, I don't think there's anything that can be done other than bridging that gap. Tribes are incredibly resourceful, and we know how to stretch a dollar. We've had to stretch our dollar. You know, we've had to come back here hat in hand. It feels like begging for what the federal government promised us, you know, when those treaties were signed. So bridging that gap between the actual need and the actual funding is I think, a great start. So thank you for that question.
Thank you. Can I ask one more? Is that all right? Yeah. So, President Keel, thank you for being with us, and I appreciate you highlighting the update of the Quiet Crisis Report. I think that provides a roadmap for our committee. In your written testimony, you mentioned the EPA's Tribal General Assistance Program and how those dollars can help build some capacity to help tribal communities address sometimes some unique environmental priorities. I want to get your sense of how this committee can help build on the success of that program, and I wonder if that success could be replicated across other federal programs too.
Well, thank you for that question. All agencies in the federal government, you know, there's, as you've heard, tribal nations ceded over about 500 million acres of land in exchange for services and things that were supposed to be provided by the United States of America in treaties. The United States demands that other nations, that treaties around the world are honored. We simply ask that the United States honor its own treaties that we've made with the tribal nations. In terms of funding, not just EPA, but all agencies across the federal government, it seems that, you know, there's a lot of money that is allocated or appropriated for different tribal nations' needs across the federal government, but they are in silos. They are different. They're located in different places, and it's very difficult for tribes to access a lot of those pools of money, because if tribes don't have really skilled grant writers, they're left out of the process. If they don't have really skilled technical advisors in many ways, even EPA and those things, then they're left out of the process. The fact is, many tribes cannot afford those technical advisors, those grant writers, because they don't have the resources. Some tribes do, others do not. But in order to replicate that, I think you would have to you would sit down with tribal nations across the country that have expertise in this. I would ask that you bring them together in one place and share that knowledge with some of the congressional committees, so that you can get a feel for where we are and how we can move forward. And NCAI would be happy to help you facilitate some of those discussions.
Thank you. Thanks so much.
Thank you. Mr. Joyce, you have some questions?
Thank you, Madam Chair. Chairwoman Kennedy, I appreciate you bringing up the GAO report about health care funding. This subcommittee actually commissioned that report last year.
That's wonderful. And thank you.
It's nice to have you shining a light on the disparity for the Indian health services. And the federal government has committed to the groups, and we shouldn't be picking winners or losers. We should be taking care of the problem, so I appreciate you bringing that up. But I wanted to ask President Keene, one of the witnesses we had yesterday had talked about the fact that there's the opioid crisis is really a trauma crisis. and that if the opioids were gone, there'd still be these underlying causes, that it would be replaced by something else because we're not doing enough to get out of the underlying causes. You feel you could expound on that at all?
Well, I think when you talk about the underlying causes, poverty, there's a lot a lot can be said for poverty. Poverty breeds a lot of other types of actions. Opioids. We've dealt with crisis and trauma in Native American communities throughout our history.
I believe that's how it was labeled, a trauma crisis.
I believe it is. 20 years ago we were talking about a fetal alcohol syndrome. Then we moved on to methamphetamines a few years ago. Now we're talking about opioids and prescription medications and those things. It still leaves trauma because those families that fall victim to these, they still have to deal with the aftermath. We have children now that are growing up being raised by their grandparents because their parents simply are not there, or they are addicted. And in fact, in some areas we see children as early as elementary school bringing drugs to school or being tested positive for meth or opioids or other types of drugs. And so it is traumatic. Because when you take a child to the emergency room because they're having some kind of difficulty, it's traumatic for the whole family.
Right.
And so, how do we deal with that? If we were somehow to be able to eradicate drugs and those things from our communities, we still have to deal with the poverty and all the other things that have been left behind, and it is a traumatic experience. Veterans, it's something I haven't talked about, but today there's two words that should never be used in the same sentence, and that's homeless and veterans. Mm-hmm. It should not be, but it is. And today, many of our veterans are on the street. They're addicted. They have addictions, and they have this trauma. They're dealing with wounds that we can't see. So there's many other levels and types of trauma that we have to deal with. I thank you for your interest and thank you for allowing me that.
Well, I thank you, all of you, and I thank Chairman Peterson for his service too, since we brought up veterans. Thank you. No further questions. I yield back.
Thank you. I just have a quick question. A couple of the members of the panel referred to the civil rights report, and tell me how the civil rights laws that they're not adequately being applied, or that you feel that there's more we need to do to ensure that we are appropriating correctly to the tribes.
Well, civil rights, in many Native communities, lack of law enforcement always is a problem when we talk about civil rights, because in many Native communities we have non-Native perpetrators who cannot be. We can't try them in tribal courts, and so we believe that's a civil rights violation. If a tribal member goes outside here and commits a crime, they are subject to the local jurisdiction here. If someone comes on a reservation and commits a crime, they're not subject to that. If they're not Native, they're not subject to the tribal court jurisdiction. And so there's a problem there that needs to be resolved. We've looked at it, and it's been ongoing for years. There are gangs and other people other perpetrators who will bring drugs and alcohol and other types of illicit practices onto the reservations because they know they can't be, they're not subject to the jurisdiction. And so there's many types of those activities that are taking place in our communities. We simply want the right to be able to protect our own in our communities. And we want the ability to put those criminals behind bars, try them in tribal court. I served on the Tribal Law and Order Commission several years ago, and there was a judge that came and testified to us. He was a law professor at the time. And he said, as a judge, as a municipal judge, I can go and sit down in this court and try cases and all that stuff. He said, my cases can go all the way up to the Supreme Court and be sanctioned. But if I take that, just move from this step, take this thing, this name tag away and call it municipal court, change it to tribal court. Now I'm no longer valid. I'm not qualified. So it doesn't make sense, and that's what he said. So when we talk about civil rights, there's been many studies. We know that many times there is a level of prejudice in many areas, many communities that exist today, bias. People don't like to talk about it, but many tribal members will be treated differently if they're outside in the community than they would in their own if they were arrested by their own police.
Thank you all so much. I want to thank each member for your testimony today, and if we will now assemble the next panel. Thank you all so much.